My name is Ethan Copple, and I'm studying both industrial engineering and anthropology at Kansas State University in order to understand systems in a more holistic sense, to help solve real-world problems more effectively and efficiently. This past summer, I traveled to rural Joyabaj, Guatemala, to test my mixed methodologies by studying healthcare. Health, amongst a large number of other aspects of Guatemalan life, have been shaped by the country's past. Unfortunately, this past has included a recent civil war, which lasted from the 1960s to 1996 and saw the deaths of over 200,000 people, primarily indigenous Mayans. Due to Joyabaj's high indigenous populations, along with other factors, it was a hotspot during the Civil War, seeing several massacres and crimes perpetrated against the populace. Joyabaj, meaning both the city and the surrounding municipality that holds the same name, is famous for a number of things, including palo volador and textiles. The municipality is located about 6 hours northwest of Guatemala City, in the mountains, making travel within and to the municipality somewhat difficult. It also means that having physical access to healthcare can be difficult due to the geographical barriers to care. This factor, combined with the Civil War and many other historical and cultural ones, make it difficult to receive quality care, something the residents feel the effects of. This leads to healthcare narratives and interviews, where using ethnographic methods, my team and I collected over 50 interviews. In this one in particular, we were told about the health disparities between the public and private healthcare systems, where only the wealthy are able to receive higher quality private care. And we were also told about the difficulties caused by economic stagnation in the area. In another case, this woman shared how she broke her shoulder and collarbone in a severe accident, but was not able to receive care at the municipality's hospital due to the lack of services provided there, and instead had to recover without biomedical treatment. From our interviews, it quickly became clear that working to improve health in Joyabaj was like climbing a ladder, where both infrastructural and health access gains are needed to be taken, one after another, in order to help prevent diseases while also decreasing both physical and non-physical barriers to care. In particular, though there are health posts scattered around, removing non-physical barriers to receiving care was identified as a central issue. A lot of these barriers come from historical racism, unhealed wounds from the Civil War, and cultural differences in what makes up quality and personalized care. The team also identified widespread use of prescription-level injectable medications, such as penicillin shots, as a challenge to look into due to the increased likelihood of drug-resistant diseases and the possibility of immunities to useful and accessible medications. Overall, there are a number of significant challenges facing health in Joyabaj. The project is still in a relatively early state, however teams of researchers are assisting me in creating solution paths for both the quantitative and qualitative challenges to show the methodological viability of the ideas to be presented. Particularly, statistical operations research, mediation, and anthropologically guided systems integration tools are being utilized for this end. Due to a number of factors, the results of the research will primarily be kept as general recommendations. However, the teams are hopeful that this research will lay the foundations for more combined anthropology and industrial engineering-based research to help ensure that systemic problems are tackled in holistic and smart manners. Though the road to greatly improved healthcare is long, and this research may not be directly utilized in assisting the improvements in health in Joyabaj, significant gains are still being made every day by the residents and officials of Joyabaj.